Good evening. This is All India Radio. I am Lalima Aneja Dang, and with me is Renuka with the evening news. The headlines. Prime Minister Narendra Modi gives new mantra of Jahan Bimar Wahin Upchar in fight against COVID pandemic. Centre issues advisory to states and union territories to protect vulnerable sections of society affected by pandemic. Health Ministry asks state governments to emulate best practices in various districts to tackle COVID pandemic. DRDO develops antibody detection-based kit Dipcovan. Over 3,57,000 COVID patients recover from COVID-19 in the last 24 hours. National recovery rate improves to stand at 87.25%. Cumulative number of COVID-19 vaccine doses administered in the country exceeds 19 crore. Niti Aayog says output of coming Kharif season not to be affected by second wave of pandemic, asserts economy to have stronger and faster recovery after June. Government invites applications from startups, companies for developing new technology to tackle COVID-19 wave. And government asks 5 states and union territories to take necessary measures for the upcoming cyclone on the 26th of May. As the number of COVID cases is on the rise, we appeal to our listeners not to lower the guard, take all precautions, and all those above 45 years of age who have taken the first dose of COVID-19 vaccine to get vaccinated with the second dose at the scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. And now the news in detail. Giving a new mantra of Jahan Bimar Wahan Upchar in the fight against COVID pandemic, Prime Minister Narendra Modi today said that we have to secure our children from the clutches of this pandemic and get ourselves prepared for this fight.
महामारी के इस हमले को आपने काफी हद तक संभाला है, लेकिन अभी संतोष का समय नहीं है। हमें अभी एक लंबी लड़ाई लड़नी है। अभी हमें बनारस और पूर्वांचल के ग्रामीण इलाकों पर भी बहुत ध्यान देना है। और अब मंत्र हमारा क्या होगा? हर व्यवस्था के लिए, हर इकाई के लिए नया मंत्र यही है, जहां बीमार वहीं उपचार। ये हम भूले नहीं, जहां बीमार वहीं उपचार। जितनी हम उपचार उसके पास ले जाएंगे, उतना हमारी हेल्थ व्यवस्था पर दबाव बहुत कम होगा।
The Prime Minister was interacting with the doctors, paramedical staff and frontline workers of his constituency Varanasi in Uttar Pradesh today.
कोरोना के इस कठिन समय में हमारे काशीवासियों ने और यहाँ काम कर रहे हर एक जन ने वाकई इस कथन को सार्थक सिद्ध किया है। आप सभी ने शिव की कल्याण भावना से ही काम करते हुए जन जन की सेवा की है। मैं काशी का एक सेवक होने के नाते हर एक काशीवासी का हृदय से बहुत बहुत धन्यवाद देता हूँ। विशेष रूप से हमारे डॉक्टर्स ने, नर्सेस ने, टेक्नीशियंस, वार्ड बॉयज, एम्बुलेंस ड्राइवर्स, आप सभी ने जो काम किया है वो वाकई सराहनीय है।
Mr. Modi said that our fight is against a regular face-changing and cunning virus, and we need to prepare ourselves for this. Emphasizing on the need for vaccination, the Prime Minister said that we must get ourselves vaccinated when the turn comes and must make vaccination a collective responsibility. He said that the importance of yoga and Ayush in the fight against this virus is proving now worldwide. Praising the Varanasi model in fight with the pandemic, the Prime Minister said that everybody in the country is talking about the way the city has fought with this pandemic. New machines for testing, facilities for oxygen supply and other health infrastructure related things have become an example for others. Addressing the event, the Prime Minister commended the work done by doctors, nurses, technicians, ward boys, ambulance drivers and other frontline health workers of Kashi. He paid tributes to all those who lost their loved ones. He especially mentioned Kashi Kavach, and said it is also an innovative experiment of the administration which is helping people get the facility of telemedicine, medicines and other related things necessary for fighting against this pandemic.
ग्रामीण इलाकों में जितना हो सके उतना व्यापक करना है। डॉक्टर्स, लैब्स और ई-मार्केटिंग कंपनियों को एक साथ जोड़ करके काशी कवच नाम से टेली मेडिसिन की सुविधा की, ये भी काशी का बहुत इनोवेटिव प्रयोग है। इसका लाभ गांव-गांव में लोगों को मिले, इसके लिए विशेष जागरूकता अभियान भी चलाना चाहिए।
He said, it is not the time for rest. Instead, we have to fight a long battle with COVID in the Varanasi and other rural areas of Purvanchal. During the interaction, the doctors and officials of Varanasi thanked the Prime Minister for his continuous and proactive leadership that helped in ramping up health infrastructure and ensured adequate supply of necessary medication and critical equipment like ventilators and oxygen concentrators. The Prime Minister was informed about the efforts undertaken in the last 1 month to contain the spread of COVID vaccination status and the ongoing steps and plans to prepare the district for future challenges. The doctors also informed the Prime Minister that they have been vigilant about the threat of mucormycosis and have already taken steps and created facilities for the management of the disease.
The Defence Research and Development Organisation, DRDO, has developed an antibody detection-based kit, DIPCOVAN, the DPAS VDX COVID-19 IgG antibody microvel ELISA, for serosurveillance. The kit will be very useful for understanding COVID-19 epidemiology and assessing an individual's previous SARS-CoV-2 exposure. The kit can detect both spike as well as nucleocapsid proteins of SARS-CoV-2 virus with a high sensitivity of 97% and specify of 99%. The DIPCOVAN kit was developed indigenously by the scientists, followed by extensive validation on more than 1,000 patient samples at various COVID-designated hospitals in Delhi. The antibody detection kit is approved by the Indian Council of Medical Research in April this year. In May, the product received the regulatory approval from the Drugs Controller General of India to manufacture for sale and distribution. Defence Minister Rajnath Singh has appreciated the efforts of the DRDO and the industry in developing the kit at the time of need. In a tweet, Mr. Singh said, this kit will help the people in their fight against COVID-19 pandemic. In view of the rising cases of mucormycosis known as black fungus, the Union Health and Family Welfare Ministry has advised all the states and union territories to review their preparedness for prevention and control of this fungal disease. The Union Health Secretary has written a letter to Chief Secretaries and Administrators of all the states and union territories. In the letter, it has been urged to undertake preventive measures in COVID hospitals and other healthcare facilities to contain the spread of black fungus disease. The Union Health Ministry has asked to establish the Hospital Infection Control Committee and designate an Infection Prevention and Control Nodal Officer. It has also asked to prepare and implement the Infection Prevention Control Program in the hospital and health facilities. The Ministry has urged for adoption of standard precautions across the hospital and health facilities.
The Union Health Ministry has asked state governments to emulate the best practices shared by various district and field officials to effectively tackle the COVID pandemic. In a letter written by Union Health Secretary Rajesh Bhushan to all the state health secretaries, he has suggested them to replicate the innovative practices by customizing them to the local needs. Prime Minister Narendra Modi interacted with the district and field officials of nearly 20 states and union territories on Tuesday and Thursday and discussed in detail the innovative strategies adopted by them to effectively manage COVID-related issues in their areas. He also asked them to share the best practices to the Central Health Ministry so that these innovative ideas can be further adopted by more states and districts. Union Health and Family Welfare Minister Dr. Harshvardhan has stressed on stepping up the vaccination process to effectively deal with the COVID-19 pandemic. He urged on the administration of the second doses of vaccine to the eligible beneficiaries. Dr. Harshvardhan today chaired a meeting on COVID-19 situation and vaccination progress with the health ministers, lieutenant governors and administrators of 9 states and union territories. Representatives of Chhattisgarh, Goa, Himachal Pradesh, Puducherry, Andaman and Nicobar Islands, Chandigarh, Dadra Nagar Haveli and Daman and Diu, Ladakh and Lakshadweep participated in the meeting. On the black fungus disease, Dr. Harshvardhan said extensive efforts have been made by the government to provide necessary treatment to the patients. He said Union Health and Family Welfare Ministry has urged the states and union territories to make fungal infection mucormycosis known as black fungus a notifiable disease under the Epidemic Diseases Act 1897.
मैं विशेष रूप से आजकल ब्लैक फंगस के बारे में बहुत चर्चा है और इसके केसेस भी जो है देश में स्थान स्थान पर आ रहे हैं। सरकार के माध्यम से उसके संदर्भ में एक्सपर्ट्स के माध्यम से सभी संबंधित जानकारियां दी जा रही हैं। उसकी दवाई का प्रोडक्शन, उसकी उपलब्धता को भी रैंप अप करने के लिए डिपार्टमेंट ऑफ फार्मास्यूटिकल्स, ड्रग कंट्रोलर, उनकी तरफ से भी विशेष प्रयास हो रहे हैं। भारत सरकार की तरफ से भी ये आग्रह किया गया है कि स्टेट्स इसको नोटिफाइबल डिजीजेस के रूप में जो है इसकी जानकारी दें।
India has achieved a new landmark in its vaccination drive as the cumulative number of COVID-19 vaccine doses administered in the country exceeded 19 crore. Over 14,82,000 vaccine doses have been given to beneficiaries in the past 24 hours. The country has so far administered more than 19 crore 18 lakh doses of COVID-19 vaccine. Out of the total, nearly 14 crore 91 lakh people have been given the first jab of the vaccine, whereas nearly 4 crore 28 lakh beneficiaries have been fully vaccinated with both the required doses. The nation continues to march strongly on its path of COVID recovery with substantial decrease in the total number of active cases. In the past 24 hours, over 3,57,000 COVID patients successfully recovered from the disease, whereas in the same time span, 2,59,591 fresh cases were recorded nationwide. With this, the recovery rate in the country has further improved to stand at 87.25%. The cumulative share of active COVID cases in the country also continues to witness consistent decline and comprises nearly 11.63% of the total reported cases. The Health Ministry has informed that currently over 30,27,000 people are reported to be suffering from the viral pandemic and are either hospitalized or under home isolation. With a special focus on the 5-point principle of test, track, treat, isolate and vaccinate, the number of cumulative COVID-19 tests reported by Indian Council of Medical Research, ICMR, has surpassed the figure of 32 crore 44 lakh. The Apex Medical Research Body has informed that in the past 24 hours, more than 20,61,000 samples were tested in the country. You are listening to the evening news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi gives new mantra of Jahan Bimar Wahin Upchar in fight against COVID pandemic. Centre issues advisory to states and union territories to protect vulnerable sections of society affected by pandemic. Health Ministry asks state government to emulate best practices in various districts to tackle COVID pandemic. DRDO develops antibody detection-based kit DeepCoVan. Over 3,57,000 COVID patients recover from COVID-19 in the last 24 hours. National recovery rate improves to stand at 87.25%. Cumulative number of COVID-19 vaccine doses administered in the country exceeds 19 crore. Niti Aayog says output of coming Kharif season not to be affected by a second wave of pandemic, assets economy to have stronger and faster recovery after June. Government invites applications from startups, companies for developing new technology to tackle COVID-19 wave. Government asks 5 states and union territories to take necessary measures for the upcoming cyclone on 26th of this month. For quick news updates round the clock, follow us on Twitter at AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो कुछ वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
BJP President Jagat Prakash Nadda today inaugurated the COVID-19 help desks at 824 community centers across the country under Seva Hi Sangathan program. The help desk is being operated by the BJP Kisan Morcha. Addressing the event through video conference, Mr. Nadda said that Prime Minister Narendra Modi-led government is committed to increase the income of farmers and their welfare.
आज हमें ये खुशी है कि बंगाल भी किसान सम्मान निधि में शामिल हो गया। देर आए दुरुस्त आए, लेकिन किसानों की चिंता वहां हुई और प्रधानमंत्री जी का ये किसान सम्मान निधि वहां आज किसानों को मिल सका है। यह हम सबके लिए बहुत ही संतोष का विषय है।
Mr. Nadda also said that a historic decision was taken by the government to enhance the fertilizer subsidy on the 19th of May, and the DAP fertilizer subsidy was increased to 140%. In the wake of rising COVID cases in Himachal Pradesh, the state government has decided to utilize the services of volunteer groups and NGOs across the state by setting up help desks and other activities at various levels. Our Shimla correspondent has filed this report.
State government has decided to expand the scope of services that can be provided at the grassroots level by these volunteers and NGOs. They should be adequately trained and sensitized on COVID-appropriate behavior, home isolation protocols, post-COVID protocols, and other COVID-related necessary information. National Health Mission Director Dr. Nipun Jindal has urged all the NGOs and volunteers who wish to come forward for this service should approach the concerned district administration. Meanwhile, the state government has decided to extend the timings of teleconsultation service, E-Sanjeevani and E-Sanjeevani OPD in the state from 8 a.m. to 8 p.m. on all working days and from 10 a.m. to 4 p.m. on Sundays and holidays. All the doctors operating the E-Sanjeevani OPD have also been trained to consult COVID patients. Sanjeev Sundaryal, AIR News, Shimla.
The 4th Oxygen Express to Vijayawada Division, Andhra Pradesh, reached Krishnapatnam port today. The train has brought 60.66 metric tons of liquid medical oxygen, LMO, filled into tankers. So far, Vijayawada Division has received 275 metric tons of LMO through 4 Oxygen Express trains. Adequate precautions are being taken so as to ensure that the cryogenic cargo is safely transported across various states. The Kerala government has decided to extend the statewide lockdown for one more week till the 30th of this month to further contain the COVID spread. Triple lockdown has been limited to Malappuram district from tomorrow onwards. Here's more from our Thiruvananthapuram correspondent.
Chief Minister Pinarayi Vijayan said that the triple lockdown in Thiruvananthapuram, Ernakulam and Thrissur district will be withdrawn from tomorrow as the test positivity rate and active case load has come down. Triple lockdown will only continue in Malappuram district. He added that though the COVID cases show a falling trend, lockdown restrictions will continue to further slow down the spread. Mr. Vijayan further assured that all necessary steps will be taken to ensure the availability of the antifungal drugs used for the treatment of black fungus disease in the state. Currently, 16 persons with black fungus infection is under treatment in the state. Meanwhile, 29,673 new COVID cases were confirmed in Kerala today. The test positivity rate fell to 22.22%. Over 41,000 recoveries were also reported. Mayusha for AR News from Thiruvananthapuram.
The Assam government has taken a step to boost up infrastructure for COVID-19 management. Talking to newspersons in Guwahati, Health Minister Keshav Mahanta said that an MOU has been signed today with the Downtown University to set up 400-bedded COVID hospital in Guwahati. He said another 200 ICU beds will be included at Guwahati Medical College and Hospital. The minister further said that steps are also being taken to upgrade these existing facilities. In Meghalaya, as the number of COVID-19 cases continues to increase, the state government is taking all steps to ensure that there is a sufficient supply of medical oxygen in different hospitals across the state. Director of Health Services, Dr. Aman War, in an interaction with media, informed that at present installation work for 6 oxygen plants is going on for different hospitals across the state. He said installation work for 2 cryogenic oxygen tanks is being done in 2 different locations.
In the Union Territory of Jammu and Kashmir, the authorities today confirmed the first case of mucormycosis known as black fungus at Government Medical College, Jammu. AIR Jammu correspondent reports that Principal GMC Jammu, Dr. Shashi Sudan, said that a mucormycosis case has been found in a 40-year-old patient and he is under observation. The patient has recently recovered from COVID-19. However, he is now suffering from uncontrolled diabetes. Dr. Sudan said that blood sugar level of the patient is 900 and has got mucormycosis due to long-term use of steroid drugs. General Officer Commanding-in-Chief, Northern Command, Lieutenant General Y.K. Joshi, visited Mrs. Dholi Devi of village Ghar Katias in Tehsil Dudu of Udhampur in Jammu and Kashmir, who has single-handedly inspired an entire village to make the COVID vaccination drive a huge success. Mrs. Dholi Devi, who is 120 years old, is a living legend and epitomizes good health in a time in which even the young people are struggling to keep their immunity intact.
The News Services Division of All India Radio in its bilingual live phone-in program tonight will bring you a special discussion on COVID-19. Dr. Lieutenant General Ved Chaturvedi, Sir Gangaram Hospital, will participate in the discussion. This can be heard on FM Gold channel and additional frequencies from 9:30 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates. In the Union Territory of Jammu and Kashmir, Lieutenant Governor Manoj Sinha today administered anti-terrorism pledge to the officials and staff members of his secretariat at Raj Bhavan, Jammu, to mark the observance of Anti-Terrorism Day. AIR Jammu correspondent reports that Special Security Forces personnel also read out the anti-terrorism pledge on the occasion. The LG observed that terrorism is the biggest enemy of humanity, which must be opposed in all forms and manifestations. He added that violence can never be the answer and peace is the only way towards prosperity and progress. The LG said it is high time we joined our efforts to defeat the forces of disruption threatening human lives and values.
Niti Aayog Vice Chairman Dr. Rajiv Kumar says the output of the coming Kharif season will not be affected much by the second wave of the pandemic. In an exclusive interview to AIR News, Dr. Kumar said,
I am convinced that the agriculture output of the coming Kharif season will not be affected because once more the meteorological department has said that the monsoons are going to be normal, and also the summer crops which are going on now, the reports are that the area covered is quite substantial.
Dr. Rajiv Kumar said the second wave of COVID-19 will surely have an unpleasant impact on the economic activity, but the country will still get a very positive growth rate for the first quarter. He said the kind of very sharp V-shaped recovery the country was expecting will be less pronounced as the economy suffered due to localized lockdowns and the consumer and investor sentiment got a beating. The Vice Chairman of the apex planning body of the country said by the end of June this will be behind us and the vaccination program would also have gone to another level. Dr. Kumar, who was a leading economist, said after June the economy will have a stronger and faster recovery than most of the people expected. He added the year will end on a positive note.
Kind of recovery we were expecting in April and May of this year would be less pronounced. Otherwise, we were hoping to have a very sharp V-shaped recovery. My own estimate is that all of this will be surely behind us by the end of June. And in the first quarter, that is April to June, we will still get a very positive growth rate, but not as high as got without this. And our vaccination program would have taken strength, and after which, therefore, I expect the economy to have a recovery stronger and faster than most people expect.
The exclusive interview with Niti Aayog Vice Chairman Dr. Rajiv Kumar on safe livelihood and infrastructure work during COVID-19 pandemic in the Surkhiyon Mein program is available on our website newsonair.com and YouTube channel News on AIR Official. To support indigenous solutions and innovative products to combat the pandemic, the Centre has come up with a new initiative, Nidhi for COVID 2.0. Nidhi for COVID 2.0 will fund eligible startups and companies registered in India offering promising solutions in the thrust areas of oxygen innovation, portable solution, relevant medical accessories, diagnostic, informatics, or any other solution that addresses or mitigates various challenges being faced due to COVID-19. The central government has notified and revised the rates of Variable Dearness Allowance VDA with a view to provide relief to different category of workers engaged in various scheduled employments in the central sphere. Labour and Employment Minister Santosh Gangwar said that this will benefit about 1 crore 50 lakh workers. The hike will be effective from the 1st of April of last month. The VDA is revised on the basis of Average Consumer Price Index for Industrial Workers, CPI-IW, a price index compiled by the Labour Bureau.
President Ramnath Kovind condoled the demise of noted environmentalist Sundar Lal Bahuguna. Terming his demise as the end of a glorious chapter in the field of conservation, President Kovind remembered the pioneer of the Chipko movement and a Padma Bhushan awardee as a true Gandhian to the core. Vice President M. Venkaiah Naidu has also expressed the pain at the passing away of Sundar Lal Bahuguna. Mr. Naidu said that our tribute to Sundar Lal Bahuguna is to strive and live by his idea, ecology is our permanent economy. Prime Minister Narendra Modi has also condoled the demise of noted environmentalist Sundar Lal Bahuguna, terming it as a monumental loss for the nation. The Union Health and Family Welfare Ministry has asked 5 states and union territories to take necessary measures for the upcoming cyclone. As per the prediction of the India Meteorological Department, this cyclone is likely to touch Odisha and West Bengal on the 26th of May. It has also predicted widespread rainfall in Andaman and Nicobar Islands and several districts of East Coast.
The Home Ministry today organized the annual conference of Relief Commissioners and Secretaries of Departments of Disaster Management of states and union territories to review the status of preparedness for dealing with natural disasters that may arise during southwest monsoon. During the meeting, the issues connected with disaster preparedness, early warning systems, disaster management on-site and off-site plans of the states and union territories were discussed. The Odisha government has put all the coastal and nearby districts on high alert in view of the probable cyclone in the Bay of Bengal. In addition, all the line departments, including health, electricity and water supply, have been put in readiness to respond to any cyclone-related exigencies.
In Tamil Nadu, Chief Secretary Irayanbil today had a discussion with 11 district collectors virtually on the ensuing cyclonic storm prediction. Chief Minister M.K. Stalin will undertake a meeting tomorrow with top officials of health, revenue and district administration also on the same issue. Owing to the warning by the Met Department of a cyclone depression which is likely to be formed off the North Andaman coast and East Central Bay of Bengal, the state is all set to get widespread rains in coastal areas from tomorrow. According to the prediction, the storm is likely to move northwestwards and reach Odisha West Bengal coast around the 26th of this month. Now let us take a look at the weather forecast for tomorrow. The national capital, Delhi, is likely to have a generally cloudy sky with light rain or drizzle. The temperature will hover between 24 and 37 degrees Celsius. Chennai is expected to have thunderstorm with rain. The temperature will vary between 28 and 36 degrees Celsius. Kolkata will have partly cloudy sky with possibility of moderate rain or thunderstorm. The city will observe a minimum temperature of 28 degrees Celsius and maximum 38. Srinagar will partly cloudy sky with possibility of rain or thunderstorm.
And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi gives the new mantra of Jahan Bimar Wahin Upchar in fight against COVID pandemic. Centre issues advisory to states and union territories to protect vulnerable sections of society affected by the pandemic. Health Ministry asks state governments to emulate best practices in various districts to tackle COVID pandemic. DRDO develops antibody detection-based kit Dipcovan. Over 3,57,000 COVID patients recover from COVID-19 in the last 24 hours. The national recovery rate improves to stand at 87.25%. Cumulative number of COVID-19 vaccine doses administered in the country exceeds 19 crore. Niti Aayog says output of coming Kharif season not to be affected by the second wave of pandemic, asserts economy to have stronger and faster recovery after June. Government invites applications from startups, companies for developing new technology to tackle COVID-19 wave. Government asks 5 states and union territories to take necessary measures for the upcoming cyclone on the 26th of this month. Well, for details of all these stories and more, you may log on to our website www.newsonair.com, and we also have an app which is called News on AIR app. And with that, we end the evening news. Good night.